had another conversation with a pretty high up leader within a health organization, and they were saying essentially that, hey, the CIO is really excellent tactically running the business of IT, but we're not basically what they're saying is, I'm not sure they're ready to be the strategy person, the person who's looking 5 years out and being the strategy person. I sat back and I thought, I wonder if that distinction is going on all over the place, and CIOs are trying to figure out, how do I get positioned as a strategy person within an organization, and organizations are saying, hey, who's going to fill this void of really the digital strategy? And so you mentioned digital as one of the areas that people are looking at. How are you coaching CIOs in that area? How are you helping them to start to think digital, to think business, and to get out in front of it?
Yeah. Do you want to take it? You want me to take it?
Yeah. No, I'll go ahead and jump in. One of the things, Bill, that I'm trying to do is to try, I know that sounds silly, is what's in a name? That's an important question to answer. And I've suggested that all the people that I'm talking to change the term, get IT or information services out of the name, and use the term digital services going forward. And the whole point is to try to take ownership of the digital strategy. And too often people conflate the word consumerism and thinking that consumerism and digital health are the same thing, and they're so radically different. Digital services sits over digital health, and consumerism is just a small part. And the reason that people are going outside to look for those CIOs from consumer-oriented organizations is because they do the two together. And so it's really critical that you come up with a strategy that gives people a much broader understanding of what digital health is, what it means to be a digital health system. And the idea is you want a digital experience, but there's got to be that analog human part of it. And so I appreciate that there are many smart people outside of healthcare who can bring a lot of creativity and innovation, analytics in, but this deep understanding of healthcare and what it means in terms of analog versus digital is together. And so a digital health system needs to figure out how to put both the analog and digital together in a way that's going to give care that's both high tech. And that's a tried term. That's something that really is important. And I see that element of analog missing, the need for digital going too far.